Okay, so as continuation of our lecture from last time, this is the regulation of your heart rate, and it is guided by several factors that you can see from the screen right now. You have there your sympathetic nervous system. Obviously, if you're familiar with your flight and your fight response, this is basically the increasing of your metabolic processes. At the same time, you have your heart rate. Actually, that would also include your eyesight being actually activated by your sympathetic nervous system. You also will be expecting that there would be an increase in your blood pressure and bronchodilation will also happen. So these are the processes that are involved in the activation of your SNS. But since we're talking about your cardiovascular functions here, SNS has a hand in the increase of your heart rate as well as your stroke volume and that of your cardiac output. Okay. In like manner, if you have your SNS, you have the flip side. You have your parasympathetic nervous system, which talks about the slowing down of these processes. Most likely, if we have your cardiovascular system function, with the activation or stimulation of your parasympathetic nervous system, you will have the release of your acetylcholine, therefore causing you to have a decrease in the heart rate. Kasi nga, ang ibig sabihin ng parasympathetic nervous system, ito yung ating rest and digest response. Okay? And then, on the third part, we have your vagal tone, which is basically a stimulation of your vasovagal response coming from the vagus nerve. Anong cranial nerve number ang vagus nerve natin. So, OOO to touch and feel a girl's vagina, heaven. Yan yung tinuro sa amin nung nag-memorize kami ng cranial nerve. 'Di ba? Yung mga cranial nerves natin. So, basically, it's your cranial nerve number 10. So, vagal tone. From the term pa lang mismo, vagal. So, in the vernacular, if you're going to pronounce that one, it's bagal, 'di ba? Because the vasovagal tone actually slows everything down. So, it's your parasympathetic inhibition of inherent rate, specifically your SA node, allowing you to have your normal heart rate. Or, if kapag ito ay na stimulate, then you might have your possibility of bradycardia for that matter. Ano ba yung mga activities that actually causes you to have your vasovagal tone stimulation? So, example of that one, okay? Okay, so you have your, oops, ayan. Example of that one would be your coughing. Yan. You have your sneezing. You have your lifting heavy objects. I'm talking about heavy objects, guys. Lifting heavy objects. Oops, sorry. Heavy objects. And you also have your straining. Straining hindi yung magluluto ka Straining when you defecate, especially if you do have your constipation or you have difficulty in actually elimination with your elimination patterns. So straining. Lahat ng mga ito actually stimulates your vasovagal response. And this is a very big no-no for patients who have your cardiovascular problems. Why? Because with the stimulation of your vagal tone, malamang sa malamang yung pasyente mo magkakaroon ng bradycardia and you don't want that to happen. There's one instance in Lorma Medical Center before, way before. I think siguro nung estudyante pa ako, merong isang mag-asawa. So they were an elderly couple who was supposed to be discharged. The husband had MI, and the wife was the one who was with him the whole time during his confinement. And on that specific day, she was processing already their discharge papers, the finances, paying for everything in the hospital. So, iniwanan po niya yung asawa niya sa room. And then, when they get back to the room, wala na po yung asawa niya. Asaan? Hindi nila mahanap. So, kasi nasa siya nasa, if I'm not mistaken, nasa charity ward siya. And mag-isa lang siya doon sa room na yun. Kasi nga, walang ibang patients. So, they were looking for him. Baka siguro naglakad-lakad doon sa my garden, mga ganyan-ganyan. Pero hindi nila nahanap until such time that they checked the CR. Tapos nakita nila doon yung asawa nakabulagta na doon sa floor ng CR. They found out that the patient was already dead and the patient has strained. Pinilit niyang tumae, pinilit niya yung sarili niya, considering the fact na discharge na sana sa hindi ba. Alam mo yung possibility na sana nakauwi siya, but because there was siguro hindi nakinig yung asawa with regards to this particular health instructions that you should not strain in any way because it will only add burden to your already weak heart. Weak na nga yung heart mo because it has suffered from myocardial infarction or your heart attack. Tapos, nag-strain pa siya when he had his defecation, nung nag-CR siya. Kaya, ayun, ganun yung ending ng patient na yun. And then, we have your baroreceptors or presoreceptors, which is a reflex activity of your autonomic nervous system in the regulation of your heart. I mean, these are very familiar concepts for you because they have been discussed in your anatomy and physiology. Okay? Next, we have obviously you have your hormones to regulate also your heart because this talks about your presence of epinephrine. Actually, your all catecholamines are responsible also for the regulation of your heart, more or less. Yung mga kapamilya ni epinephrine or epinephrine, yung mga adrenal hormones natin na mga ganyan, sila po ang nagpapataas at nagpapa-increase ng ating heart rate. Most especially if you're under stress. Okay, under stress. Now, next we have your thyroxine, which is a hormone from your thyroid gland. This is your T4. Your triiodothyronine, that's your T3. Kapag ikaw ay nurse and you are supposed to be checking your client's laboratory values and then we are going to be managing a patient who has your thyroid problems, itong T3, T4 na ito, na mga tests na ito, are very, very familiar on their documents and on their papers. But for just a review, I hope you can still remember, that's your T4, and your T3 is your triiodothyronine. Okay, so thyroxine and then triiodothyronine, both are actually hormones which are responsible for your metabolic processes. More or less, kapag ito ay released sa system mo, it increases your heart rate in large quantities and it amplifies the effect of your epinephrine. Wrong spelling. Epinephrine. So, hormonal, chemical regulation, you refer it to your epinephrine, your catecholamines, and also your thyroxine, your your thyroid gland hormones. Okay? Next, we move on to your electrolytes. So, with your electrolytes, we always think na, oh, ito, electrolytes is para ano lang to eh, dehydration, ganyan. But no, if you can still remember your discussion in your biochemistry, these electrolytes are very important in so many processes in the body. One of which is, well, it helps in your building of bones, etc. Alam mo yung usual na understanding natin kapag merong calcium, kapag merong kang potassium, or even your sodium. Okay, so ito pa lang, meron na siyang significant function. But if you're going to be talking about its purpose or its presence in the cardiovascular system or in your cardiac muscle, these three provides a definitive help in the contraction and in the conduction of your heart. If you can still remember, your concept of your sodium and potassium pump. I hope na discuss itong sodium and potassium pump natin ha. I'm talking about your sodium, potassium. Ay, bakit yan? Sandali. Yan. Sodium, potassium pump. This is a very important process in the influx of your electrolytes going into inside the cell, specifically in your myocardial cell. Well, it appears and this pump is present all over the body. But ang pinag-uusapan natin dito, yung sodium and potassium pump na relevance doon sa ating myocardial tissues. So, if we can, still again, remember, paulit-ulit lang ko sinasabi, sana naalala ninyo yung ating sodium and potassium pump, yung pagpasok ng ating potassium at paglabas ng ating sodium para magkaroon ng ATP, hindi ba? Your adenosine triphosphate, which is necessary in all metabolic processes. Kung wala ito, hindi ma-initiate yung ating ATP. At kung walang ATP, wala pong energy yung cell natin. And kapag walang energy, yung metabolic process na expected na mangyari sa cell ay hindi po mangyayari. Okay? So, remember that the heart needs to work overtime. I mean, hindi po nagpapahinga yung heart natin when it does its job. Its job of conducting, its job of contracting, its job of facilitating your oxygenation. Because if in any moment mag-stop si heart, patay po tayong lahat. 'Di ba? So that's why these electrolytes are very important. They need to be present all the time in appropriate amounts. Okay, in appropriate amounts to facilitate the metabolic process that's happening in the heart. Now, as you can see here, we have the concepts of hyper and hypo. Kapag nasobrahan naman yung ating electrolytes, nagkakaroon tayo ng adverse effects or adverse reaction. As you can see in the first one, you have your hyperkalemia. Okay, question by the way, what are your potassium-rich foods? Kung maalala ninyo, rich foods. You're done with your nutrition. You should know this one, guys. Okay? Potassium-rich foods. Because we have the concept of hyperkalemia there. Maalala pa? Can you say ano yung mga potassium-rich foods natin dyan? Okay? So, for those who were under me, I have taught this one before. In anatomy and physiology, potassium-rich foods, and then versus your sodium-rich foods. Okay, this was taught to me in NCLEX, and they said that para mas madaling ma-memorize kung ano mga potassium-rich foods, tandaan, lahat ng galing sa taas, mga puno man yan na merong mga fruits, those are your potassium-rich foods. Lahat ng nandoon sa baba, lahat na nasa ground, those are considered your sodium-rich foods. Okay? So, understand that one. Or you can have the acronym, yung acronym, never mind, sako na lang natin pag-usapan yan, sa fluid and electrolytes na lang. But, well, this is the shortcut version of your potassium-rich foods and your sodium-rich foods. Now, we are in the concept of your hyperkalemia. Ang hyperkalemia is the presence of a lot of potassium in your system. Ang normal value ng ating potassium should be around 3.5 to 5 mg per liter. Yan lang dapat ang nasa loob ng katawan ng tao. Kaya lang, kapag nasobrahan, it has a very serious and deleterious effect on the heart. And as you can see there, it says KCl as lethal injection. Yes, kung napapansin ninyo in many different television series, we have, or maybe yung mga telenovela ng mga Pilipino, mga tsakang mga telenovela na yan, tapos nasa hospital, yung bida, naka-confine na ganyan, tapos they are unconscious, and then we have this villain coming over the room with the mask on, tapos they are injecting something on the IV line. That is for everyone's information, is your KCl. And your KCl is a medication which is considered as your lethal injection. Yes, ang KCl ay supposed to be, okay, ang KCl ay supposed to be binibigay na IV drip para sa pasyenteng merong bagsak na potassium. That is its main function because it provides what is missing. Kaya lang, if it is used, not used, but it's abused in a manner that will have critical effect on the patient to the point that he's going to die, yan yung lethal injection. Okay, yung mga prisoners natin who are up for that sentence, ito yung mga binibigay nila. Yung i-inject lang. Instead of having your guillotine, yung, di ba dati pinupugutan yung ulo o di kaya hinahang, ano bang sabi nila? This is what we call their humane. Humane ba? Hindi eh. Less painful siguro na way of actually dying from your death sentence. But yes, that is your KCl, lethal injection. Kaya kung ikaw ang nurse, huwag kang magkakamali na mag-inject ng KCL sa pasyente mo kasi diretsong patay ang pasyente mo. The effect on the heart, it will usually start with your dysrhythmia, and eventually with your dysrhythmia, magkakaroon siya ng asystole. Eventually, patient will die. Okay? Paano dapat ibibigay ang KCL? I am pretty sure this has been discussed to you in pharmacology. Dapat IV drip. Ibig sabihin nun, yung IV na medication na ito ay minimix doon sa dextrose. Hindi po buong IV push, no. IV push of your KCL is tantamount to saying that you are going to let the patient die by death sentence. Okay? Next, we have your hypokalemia, arrhythmias. Actually, for everyone's information, your potassium, whether it is high or low, in both cases, you will always have your arrhythmias, which is a very dangerous condition for your patient. Especially kapag weak yung heart ng pasyente mo. Magkaroon ka lang ng konting arrhythmia, naku, ang dami mo ng gamot na kailangan i-prepare para sa pasyente. You need to do a lot of monitoring. Sila yung mga merong mga nakakabit na cardiac, yung mga chest leads na nilalagay, yung mga nakadikit, tapos naka-connect siya sa cardiac monitor. Yan yung mga pasyenteng yun. Those who are suffering from dysrhythmias or your arrhythmias. Okay? And then we have your hypocalcemia or your hypercalcemia. Usually when we think about your calcium, we always associate it with your bone production o di kaya yung composition ng bones natin. But no, it's not just that's not only its purpose or function, it also facilitates your heart function, specifically the contraction. Okay, specifically the contraction. So kapag maalala ninyo yung sodium and potassium pump, lumabas si sodium, pumasok si potassium, and at the same time, pumasok din si calcium para magkaroon ka ng contraction. Okay? So that's basically the effect of your electrolytes on your heart muscle and your heart cells. Okay. So, nasabi ko na ito, hormonal and chemical regulation of the heart via your electrolytes. And then for other factors, well, this is a no-brainer detail that you will know about your heart rate. So, exercise kapag nag-rest ka, obviously, di 40 to 60, o di kaya kung mas mabilis yung exercise, di mas tataas din siya. In like manner, when you have your heat, when it's too hot, people who are suffering from heat stroke will have your increased heart rate. Yan, it's because of the effect of your, of your heat. Okay, and then you have your cold weather, katulad ngayon, okay? We have a decreasing of your heart rate significantly, or those who are living in high altitude places, you can have your decreased heart rate for that matter. Okay? Next, we have ayan, assessment of clients with cardiovascular disorders. Ano yung mga signs and symptoms that are expected of patients who are suffering from cardiovascular disorders? Mauna muna tayo sa risk factors pala bago yung assessment natin. So with the risk factors, we have non-modifiable risk factors. Obviously, hindi mo naman papalitan kapag matanda ka na. Talagang you are expected to have a higher risk for cardiovascular diseases. With the gender also, there are some type of disorders which has a high affinity to maybe male or female, and even the race and also your familial disposition or your heredity. So you have your age, gender, race, and your heredity. Next, we have modifiable risk factors. When we say modifiable, ibig sabihin nun, may chance pa. May chance pang baguhin. May chance pa ng improvement. May chance pa na mawala. Okay, so your modifiable risk factors include your stress, your diet, exercise, sedentary lifestyle. I think for many of the cardiovascular disorder patients that we have, ito palagi yung nakalagay sa discharge instruction. Always have your exercise and improve your lifestyle. Smoking, yes, itigil na po natin ang paninigarilyo, pati ang pagiging tumador. Kaya dapat ang alcohol dito ay wala. Hypertension, why is this considered as a modifiable risk factors? Because with your hypertension, it's fairly manageable. You have your maintenance medications for this one, okay? And even your lifestyle change to actually affect the the progress of your recovery from your hypertension. Next, we have your hyperlipidemia. Likewise, with your hypertension, DM, diabetes mellitus, and even your obesity. Type A personality patients are those who are on the go all the time and they are stressed all the time. Kasi ito yung mga performing people, those who are overachievers. Ayan, maraming iniisip, maraming stress sa buhay. Ayan, type A personality. Question, are you a type A personality? Okay, and then we have your contraceptive pills. Yes, when you have your contraceptive pills for family planning or for avoiding your pregnancy, you have to see a doctor for this one and do not just start taking it without having seen a physician or without consultation. Kasi meron tayong mga side effects that you need to be knowledgeable about or be aware about. Or else, yung mga side effects na yan, kapag hindi mo alam at hindi nakita ng doktor and associate it with your patient or with your history, yung medical history, patay kang bata ka. There are many instances wherein because they have, alam mo yon yung mga nakigaya lang. Kasi sabi nila, kapag magtitake ka daw ng contraceptive pills, gaganda daw yung kutis mo. Look at mga mga homosexuals. Okay? Di ba yan yung mga contraceptive pills natin? In like manner, for the ladies, please, okay, you have to be very particular about taking this one, but you need to have your consultations. Okay? Next. Next, we have your, ayan, ito na yung mga assessment natin, signs and symptoms that are anticipated when we are dealing with your cardiovascular disorders. So, common clinical manifestations, dyspnea. Bakit kaya dyspnea? Eh, di ba, when we are talking about dyspnea, it's always your respiratory disorders. No, hindi po yan, restricted only to your lung functions or your respiratory disorders. You have to understand that with your cardiovascular disorders, it works hand in hand with your respiratory system. So, there are instances or patients who also manifest or exhibit your signs and symptoms that are relative to your respiratory function. So, one of which is actually your dyspnea. Okay, you have your exertional. Alam mo yung pagod na pagod. Gagalaw lang siya ng konti, gagawa lang ng konting ADLs, pero nahihirapan na siyang huminga. And you can blame the heart for that one, especially if the patient is having your MI, or di kaya patient is having your angina, or di kaya the patient is suffering from your not pleural effusion, but pericardial effusion, o kung saan merong tubig doon sa sac that is covering the heart, or for a patient who is suffering from heart failure. Ayan. Most of these patients, hindi sila nagko-complain ng chest pain. Anong kino-complain nila? There is fatigue and there is difficulty in breathing. And we will be discussing why our patients are suffering from this type of manifestation later on when we are going to be moving to the disease proper. So we have your exertional dyspnea. Orthopneal dyspnea, ibig sabihin nun, kailangan niya ng maraming pillows para makahinga. In the same manner, there are also patients who suffer from your nocturnal dyspnea. Sa gabi siya nahihirapang huminga. And you have your Kind-Stokes type of respiration. Usually, we associate this to the, let me put quote unquote, yung deathbed. Yan, respiration. Bakit ka mo may deathbed respiration dyan? Kasi, not lahat, but most of the patients that are seen of your Kind-Stoke, ano ba yung exhibit ng Kind-Stoke na respiration? Yung it's very deep respiration, tapos mabilis, tapos biglang mag-apnea, and then babalik ulit sa deep respiration. Alam mo yung tipong mamamatay na hirap, parang hirap na hirap huminga. That is the respiratory pattern of a patient who has your Kind-Stokes. Okay? And clients who are unconscious because of your cardiovascular ailment may manifest your Kind-Stokes respiration. Next, we have chest pain. Ito ang pinaka-common sa lahat ng mga manifestations ng cardiovascular disorders natin. Talaga, pag pinag-uusapan ang heart, chest pain talaga Okay, so there are different characteristics of chest pain. We have patients complaining about pressure in your heart, or there is fullness in the heart, and there's tightness. Ayan. Tightness, parang masikip, di ba? Masikip. Kaya, in-associate niya masikip ang dibdib. Well, pagtatanungin mo, it's either yung heart nila because there's chest pain, or because there is your dyspnea. Ayan. And then next, you have your knife-like stabbing. Yes, parang sinasaksak yung chest pain mo. Um, there's also complaints of patients that parang may umaapak na elepante doon sa chest niya because it's crushing and it's searing chest pain. And then there are also some other patients who arrive in the emergency department and they complain about, apart from the ones that I have mentioned before, you have a radiation of your pain from your back, neck, jaw, shoulders, and one or both arms. These are manifestations of patients suffering from your myocardial infarction. Okay? So kapag ikaw ay gagawa ng patient history mo or medical history, or you try to interview your patient, or if not the patient, at least yung significant other, always ask, what is the characteristic of pain? How long did it happen? Ano ang mga prior activities of the patient before he experienced your chest pain? So you do your medical history, you do your patient history interview properly so that at least the information that we will relay to the physician is very important and is very significant para makapag-come up siya kung ano ang regimen or therapeutic regimen na ibibigay para sa pasyente natin. Okay? Your interview matters because it will help in the diagnosis of the doctor. Okay? Yes. Next, we have your common clinical manifestations also include your edema. When we say edema, the 5 signs of inflammation, edema usually is associated with your inflammation. But in this case here, it also involves the shifting of your fluid from your intravascular compartment to your interstitial spaces. Pag sinabi natin intravascular compartment, ibig sabihin, nasa loob lang ng blood vessels ang ating fluid. Okay, tama ba? Kung maalala ninyo sa ating anatomy and physiology, so we have your fluids here, you have your blood volume there, okay? Kaya lang, with your edema, okay, in the vernacular, anong tawag mo dito? Ito yung manas. Kaya lang, marami po tayong iba't ibang characteristics ng manas. So, anong nangyari dyan? Yung fluid na dapat nandyan sa loob, lumabas dito sa interstitial spaces. Kaya ganyan ang itsura nila. Mukha kang mojako. Okay? So, ascites. Ascites is you have that beer belly thing. Masyadong malaki yung tiyan mo. I will be showing to you pictures of it later. You have your hydrothorax. Yes, nandoon sa thoracic cavity yung fluid. Na dapat yung thoracic cavity mo, basically yung pleural cavity mo, ay dapat wala talagang laman kasi dapat air lang yun, di ba? Kaya lang, napuno ng tubig kasi nga, lumabas sa blood vessels yung ating yung ating blood volume and then pumunta sa space doon sa ating thorax. Okay, next we have your anasarca. Anasarca is generalized edema. Ibig sabihin from head to toe, talagang malaki ka because of the fluid shifting. Okay, and then you have your bilateral pedal edema. Bilateral means both limbs, and also pedal means your feet. Okay, we have pictures of that one. Ayan. Yan. This is anasarca. Okay, kaya sabi nila beer belly. Okay, but beer belly sa mga tumador is different from the anasarca because as you can see the veins. Ayan, no? And then we have your pitting edema from your shin, as you can see there. Well, aside from the fact that there is also your pedal edema, unilateral, as you can see. Yan. Ayan po ang ating edema. And then, I have seen this one in ICU. We call it your scrotal edema. Even yung mga ganito na areas kung saan dapat hindi lalaki, will be very much affected when you have problems in your heart. Kasi di ba maalala niyo, your heart facilitates the pumping of your blood to reach other organs and distribute your blood volume with your oxygen para magkaroon ka ng proper tissue perfusion. But since may problema doon sa ating heart mismo, we have a weakened heart or there are structural problems with the heart, you end up having this one. Maalala niyo yung discussion ng backflow of your circulation. Dapat yung blood volume natin from your right atrium to your left ventricle to your lungs, going to your right to your left atrium to your left ventricle and then to your aorta and outwards. Ang nangyayari kapag meron kang heart failure is that bumalik lahat. Instead na mag-move forward, nag-backflow yung ating fluid hanggang sa bumalik doon sa organs natin, bumalik dito sa feet natin, bumalik dito sa systemic circulation natin. That's why they end up having that one. And these are classic signs of your congestive heart failure. Okay? Next, we have palpitations. We have your hemoptysis. Palpitations, alam niyo na yan. Okay? You have your hemoptysis because there is involvement also of your lungs here. Kapag yung lungs mo, nagkaroon ng backflow ng fluid doon sa lungs mo, obviously, hindi siya magkakaroon ng proper gas exchange. And because there's no proper gas exchange, because of the presence of increased fluids in your lungs, technically, you will have increased pressure in your lungs, causing you to have maybe your alveoli to actually burst. Imagine mo yung magkakaroon ka ng lung collapse, tapos magkakaroon ka pa ng injury because there is your constant inflammation in your respiratory system, especially doon sa lower respiratory tract ninyo. Eventually, the patient might be having your hemorrhage there kasi sobrang taas ng pressure. Next, fatigue. Ang pasyente na may fatigue, syncope, and fainting is because they do not have appropriate tissue perfusion. Kapag walang appropriate tissue perfusion, ibig sabihin nun, less yung oxygen na nare-receive ng mga tissues ng katawan. Okay? So, it will be manifested as something that will show na hinang-hina yung pasyente natin. Okay? There is body malaise, there is fatigue. Patient cannot move appropriately at all because most of the tissues do not receive your oxygen, and your oxygen is important in your metabolic process. Okay? Next, we have your cyanosis. Well, your cyanosis, by the way, is one of the late signs of patients who do not receive enough tissue perfusion. Abdominal pain, yes. Actually, meron tayong mga pasyente na nagkakaroon ng heart attack, pero nagra-radiate yung kanilang pain. Hindi ba kanina nasabi ko, yung pain na nagra-radiate hindi lang dito sa chest, but eventually it also goes to areas such as your shoulder, your neck, your back, or even your arms or both arms. But in some scenarios, such as your geriatric patients or yung mga matatanda, pwedeng magmamanifest. Ang complaint lang nila, masakit ang tiyan nila. Pero pagdating doon sa emergency room, after nakuhanan siya ng ECG, malalaman na lang namin na yung pasyenteng nag-complain ng masakit ng tiyan ay MI na pala. Yan. This is because there is yung changes ng ating anatomical structure kapag matanda ka na. Tsaka kung sobrang taba pala, kapag obese patients and geriatric patients, we have many patients who are arriving in the emergency department, tapos geriatric sila, tapos obese sila. Tapos initially, ang complaint nila is abdominal pain. Tapos na pala yun, MI na pala yun. Okay? And then we have here your clubbing of fingers and also your jaundice. Jaundice, this is the yellow discoloration of the skin. Yellowish discoloration of your skin. This can be associated with problems in coagulation and also with your gastrointestinal function, which can likely happen if there is your multi-organ problem that is associated with your heart ailment. Okay? But your clubbing of fingers, ano ba yung clubbing of fingers na yan? Ito po yun, no? Ay, i-erase ko ha? Okay. Pero kita nyo naman, your clubbing of fingers. If you're going to check your nail beds, okay? Try to do this one nga. Yung iyong dalawang thumb dalawang thumb mo, iharap mo. Magkaharap dapat sila. Okay, you put them, yung thumbnails ninyo, iharap ninyo. So, if you have this thumb, ayan, ito yung nail, thumb mo yan, tapos, hindi ko pwedeng ma-show, basta ganyan. Ganyan ninyo, itabi ninyo, iharap ninyo, yung dalawang thumbnail ninyo. Ayan. Tapos tingnan nyo, di ba may butas dyan? Makita nyo dapat yung parang diamond. Ayan. Ibig sabihin nun, ang iyong um, normal ang iyong assessment for your thumbnail. Okay, for your thumbnails. Normal sa gitna, kung wala kang problema sa yan, dapat ganyan. Tapos merong makitang diamond dito. Ito yung thumb na pinagharap mo. Dapat makita mo parang diamond dyan. May butas dapat. Ibig sabihin nun, okay, that's normal. However, with this type of clubbing, clubbing is parang nag-increase yung ating nail beds, especially your nail beds, because kulang ang tissue perfusion. Di ba yung ating nail beds is doon sa, distal, is one of your distal structure of your limbs, of your upper extremities. And, well, even your lower extremities, you have your nail beds there, and they are the distal parts. Pinaka malayo doon sa heart natin. So, therefore, hindi ito ang priority ng heart mo to disseminate the oxygenated blood. Okay? At kung ang pasyente mo ay merong heart failure, uunahin niya yung mga vital organs na nandito sa core mo, dito sa trunk mo, banda. Yung ating nail beds will likely receive the least amount of oxygen kasi yung iba nandito na sa trunk mo. Sa patient na merong congestive heart failure, ang nangyayari dyan is your body, your sick body, will actually try to compensate. Okay? Gagawa siya ng paraan na sana makareceive siya ng oxygenated blood. So, ito ang resulta dyan. It will try to increase the pads. Okay, not the pads, but the nail beds itself. Yung size ng nail bed mo. Para kung sakasakaling meron mang makalusot na oxygenated blood na nag-circulate dito sa area nito, meron silang makuha kahit konti. Kaya ganyan ang itsura ng ating nail beds. Kasi nga, this is it's the body's way and manner on how to catch the most number or most percentage of oxygen na pwede niyang ma-receive. Alam mo yung parang nagbe-beg siya ng oxygenation, but it doesn't happen na, it cannot be resolved immediately because the problem there is the heart. Okay, yung problem niya yung heart, hindi maganda yung pumping effect niya, hindi masyadong mataas or hindi appropriate yung cardiac output na lumalabas. Okay, that's why you have your clubbing of your fingers. Okay? Another common clinical manifestations that you can see is if you do your physical examination, okay, sa mga pasyente na merong heart problems, ganito sila. Kasi, di ba, mahirapan silang huminga. So, most of them will be in low Fowler's or semi-Fowler's or even high Fowler's position. And because there is problem with the backflow of your fluids doon sa lungs natin at even pabalik doon sa ating system, ayan, kitang-kita nyo naman, there is your jugular vein distension. Laki, encircle ko. Para sa normal na mga tao, healthy individuals, we do not see that one. But for patients who have heart problems, that's very obvious. That's your jugular vein distension. Okay, let me write that one. Vein distension. Okay, and then you are going to check also on your respiration, pulsation, clubbing, nasabi ko naman yan. Capillary refill dapat 1 to 2 seconds. Okay? 1 to 2 seconds lang dapat. At dapat pinkish yung lalabas. Pero pag hindi, patay kang bata ka. Ibig sabihin na kulang ulit yung tissue perfusion natin. Okay? Next, we have your pitting edema. Pitting edemas are again seen in patients who are suffering from your fluid shifting. Sabi ko kanina, example ng ating congestive heart failure, di ba? So as you can see, we have your grades. Yan, 0 plus, 1 plus, 2 plus. Nakikita nyo doon sa ating screen, ayan, we have 0 millimeter rule. Obviously, ibig sabihin nun, walang problema dyan. Walang problem with the fluid shifting. However, if you have your positive 1 or 1 positive, it's what we call your mild pitting edema, pero yung depression upon palpation or upon pressing on the skin, there is 2 millimeter depression that disappears rapidly. This is not too significant. However, if you move on to your 2 plus, 3 plus, and 4 plus, ibig sabihin nun, something is going on. Something is wrong already. You have to um, relay the information to the physician, or likely this is a common scenario if you already have the disease ng heart failure or congestive heart failure. Okay? So, ganyan ang ating pitting edema and how you are going to assess your pitting edema. Okay? Next, and then we have your functional capacity. We call this one functional capacity because ito yung um, karagdagang diagnosis when we have your heart failure. So, usually doon sa ating face sheet sa hospital, meron tayong tinatawag na face sheet. So, doon sa face sheet, nandun yung biographic data ng patient plus yung diagnosis ng pasyente. So, kapag ang pasyente mo ay mayroong heart failure, ayan, may iba't ibang levels pa ang heart failure natin. Okay, hindi lang sa heart failure na ganyan, but meron pa iba-ibang levels. Depende kung gaano ka-severe ang sitwasyon na meron ang pasyente. So, heart failure with functional classification is either 1, 2, 3, or 4. So, functional classification or functional capacity with your class 1, may heart failure. Tandaan, magkakaroon ka lang ng FC na diagnosis kapag ang pasyente mo ay may heart failure. Wala pong functional capacity kapag meron kang myocardial infarction or coronary artery disease, ha? It's only your heart failure, okay? So, heart failure with functional capacity or functional classification, 1, there is no functional limitation of activity, symptoms with extraordinary physical work. Ibig sabihin nun, kayang-kaya pa ni pasyente, kahit meron siyang diagnosis na heart failure, kayang-kaya pa ni pasyente. Carry pa yan. But, in class 2, there is already a starting restriction or limitation in the physical activity. Kasi medyo nakikita mo na may mga signs and symptoms na ng siguro yung dyspnea, yung mga yung mga fatigue, yan yung mga signs and symptoms, yung mga sinabi ko kanina, that is related to your heart failure. So, symptoms with ordinary physical work. Kaya pa naman, kaya lang, alam mo yung pagtitingnan mo yung pasyente, if you do your observation assessment, meron ka lang makikita mga manifestations that are minimally seen from them. Next, you have your for class 3 and class 4, well, these are points of concern. Kasi, with your class 3 functional classification or functional capacity, we have your marked limitation, as in kitang-kita mo na, obvious na medyo hirap si pasyente. So, symptoms are very much seen with less, okay, or with few na lang talaga ang kaya niyang gawin. Kahit mag-toothbrush, kahit mag-take a bath, kahit magluto, ganyan, medyo hirap si pasyente, and the manifestations are actually seen, very, very obvious. And in class 4, talagang si pasyente nakaratay na lang, nandiyan na lang sa bed. Kasi, hirap si patient, and the symptoms are even very obvious, even if the patient is just lying down in bed. So that is your functional classification 1, 2, 3, and 4. Okay? So, yep. Next, we have your diagnostic assessment. We have your blood studies. Actually, I might just be giving this to you because pinaka-importanting tandaan nyo dito are the values. Hindi naman na papalitan yung mga values natin. Okay, so I'll just be giving your diagnostic assessment, your blood studies. That would include your CBC, RBC, hemoglobin, hematocrit, okay, your RBC indices, platelet count, memorize na lang yan. Also include your WBCs, your WBC count, differential count, yan, memorize nyo lahat ang mga yan. I might be giving a quiz with regards to the normal values. Hindi naman nababago ito. Okay? And that would also include, yan, coagulation, screening time, your bleeding time, So I will be providing this to you para basahin nyo na lang. Okay, no need for further discussions. Well, its significance would be appreciated more if we will be talking about this diagnostics during your specific disorders. So for the meantime, your diagnostic assessment, I'll be just providing you the information. Okay? So that is it. Also includes your ESR. Ayan. And then this one. Please read up on this one. I might be asking questions about your cardiac protein enzymes. Understand that for a person who is suffering from angina pectoris or even your myocardial infarction or your structural problems with your heart, these are the usual diagnostic assessments, okay, blood chem, na usually ginagawa ng mga doktor or nire-request ng mga doktor because they would like to find out if the presence of these enzymes or these proteins would confirm the state of the client's myocardial tissue. Okay, so for example, you have your CKMB. It's an accurate indicator of myocardial damage. Actually, most of your cardiac enzymes are indicators of your myocardial damage. So, memorize na lang kung ano nakalagay dyan. Yan na. Okay, straightforward. This is what it actually means. Okay, most of our physicians do not rely on your CKMB to confirm if there is your ano to, myocardial tissue damage or myocardial injury. Kasi kapag sila ay nag-order, hindi lang iisang cardiac protein enzyme ang hihingin nila. Meron pang iba. Katulad nito, your lactic dehydrogenase or your LDH, it's an established marker for the late diagnosis. Ayan. So, para malaman ng doktor kung ang pasyente mo have your myocardial infarction or myocardial damage, hindi lang iisa. So, malamang si doctor ay magkakaroon ng request for CKMB, magre-request ng LDH at the same time. Meron pang iba. Yung myoglobin, ito lahat. Yan. Again, all of these are blood tests. And from the blood test, they would like to isolate these cardiac enzymes because yung value niya ang basis para ma-explain or interpret na, okay, may problema si heart natin. Okay? These are not confirmatory tests for your myocardial tissue injury because this works along with the other cardiac enzymes to give information, complete information on what's happening to your heart or to the patient's heart. Okay? Sabi nga dito, not used alone as a cardiac marker. Cannot be. Okay? So, it needs to be seen along with the others that I have mentioned previously. So, meron pang isa. Ito naman, ang ating troponin. Ito ang pinaka-importante sa lahat. Sa ICU, most of the doctors, apart from having your CKMB, LDH, and your myoglobin, meron tayong troponin I and troponin T because these cardiac markers provide the earliest, okay, the earliest confirmatory confirmation that there is your myocardial tissue injury. Okay? Usually, ang ni-utilize is troponin I. Okay. Pero doon sa amin sa ICU, parang troponin T yung ginagamit palagi. Bakit kamo? Kasi hindi bumabagsak kaagad ang ating troponin I and troponin T. Compared to the others, yung TKMB natin and your myoglobin, bumabagsak kaagad sila kasi. Look, returns to normal in a day for your myoglobin. Ayan, I'd like to check on that one. Ayan. So, kapag nakuha mo, there's a possibility for false positive response or false positive result kapag magre-rely ka lang or itong myoglobin lang ang titingnan mo. So, dapat hindi. Dapat meron kang iba pang kasama na mga cardiac enzymes. Okay? So, like for example, ayan no, your lactic dehydrogenase elevates in 24 hours. Parang ang tagal. Okay, parang ang tagal. And then you have peaking of 48 to 72 and tries to return to normal to 10 to 14 days. And you also have, ayan, CKMB. Yan, hanggang 3 days lang ang effect. Hindi mo man ma-identify kung talagang ilang araw lang yan. Parang 3 days or kung kailan nag-start, 'di ba? Okay, but it's very important that we have all of these myocardial proteins and enzymes to be seen together para si doktor hindi mahirapan gumawa ng diagnosis at gumawa ng therapy para sa pasyente. So, ito nga, sabi ko, elevates within 3 to 4 hours, very fast, right? So you have your peak in 4 to 24 hours and persist for 7 days to 3 weeks. So if you're going to compare to the others, this is the best option to know that there is indeed your myocardial tissue injury or you have your myocardial damage. So early and late diagnosis can be made with your troponin. So it's fine. Kaya nga sabi ko, this is the one that's actually more or less used for the diagnosis of MI among patients in the clinical area. So, troponin value is trop I, para hindi kayo mahirapan, ayan, tandaan, the number 6. Kasi, 0.6 nanogram ml. Okay? So, obviously, yung troponin T, number 4. Kasi, 0.4 nanogram ml. Okay. That's, no, parang sample lang ng, ay ano to, yun yung tinuro sa amin sa NCLEX. Okay, next we have your serum lipids. Your serum lipids, if you're going to talk about this, most likely is associated with your lipids. Lipids means fats, hindi ba? So, fats. So anything that has something to do with fats like cholesterol, triglycerides. Okay, hindi po to sugar ha. Triglycerides is actually related to your fats. Lipo, ayan, lipo is fat, lipoprotein levels. Why do we try to study and understand this? Because one of the risk factors for having to experience or having to suffer myocardial infarction and coronary artery disease is because that fatty content in your arteries. Okay, fats in your arteries. And well, or maybe even in your body because kapag palaging mataas yung content niyan, nagkakaroon ka ng fatty deposition doon sa ating arteries. Okay, so the normal value for that, for cholesterol, is 200 milligram per deciliter. If you have more than that one, it's a red flag. Likewise, if you have your triglycerides, 40 to 150 milligram per deciliter ang normal. LDL, 130. HDL, 30 to 70. Ang instructions mo sa pasyente na merong schedule for your serum lipids is to do your NPO post-midnight. Usually 12 hours. 8 to 12 hours. Maalala ko sa clinical area, 8 to 12 hours. So, basta NPO post-midnight. And then, yung mga medtech natin, pumupunta na lang sa bedside, tapos mag-extract sila ng blood dyan specimen at around maybe 8 o'clock or maybe 9 o'clock. In time for for breakfast. Para pagkatapos na ma-extract yung pasyente, ayun, pwede na ulit. Okay, pwede na ulit kumain. So, this is I have a video recording of this one and I'll be posting this one as well. So, please review on your lectures that I have uploaded and also on the lectures that we have had last time. Thank you very much.